You're all set.
Thanks, Pat. Okay, I'd like to call the March meeting of the Albany County Health Committee meeting to order. Before we start, Rebecca Kennedy, could you call the roll?
Sure, Mr. Chairman. Mr. Joyce?
Present.
Reedy?
Here.
Beston?
Here.
Collins?
Here.
McLean Lane? Miller?
Present.
Moriello?
Here.
Ward?
Here.
And Willingham. 7 present, Mr. Chairman.
Thanks, Rebecca. Okay, under previous business, number one, motion to, can I get a motion to approve the previous meeting minutes?
I'll make a motion.
I'll second.
Motion by Mr. Beston, second by Mr. Ward. All in favor?
Aye.
Aye.
And thank you. Number two, a local law, number K for 2021, a local law of the County of Albany, New York, to provide for the safe disposal of opioid medications. I believe we're tabling this.
Okay.
Is that correct?
Yes, both item 2 and 3.
Okay. Can I get a motion to table number 2?
Oh, it's actually tabled at the request of the sponsor, so no motion needed.
Oh, perfect. Thanks, Rebecca. Number 3 is also tabled at the request of the sponsor. Number 4, authorizing an agreement with the Psychiatric Group of Albany regarding psychiatric services.
Mr. Chairman, that's actually number 7 on the agenda. We've moved it off the side.
Oh, I'm sorry. I'm looking at an older agenda then.
Nope, you actually are not. Item 4 is, I believe, being withdrawn in lieu of being replaced by item 7.
Okay.
Got it.
Thank you. Okay, under current business, is number 5, establishing a policy that all county office buildings be equipped with lactation rooms for nursing employees and amending the 2022 Albany County budget. I believe we have Ms. Plaskinen tonight.
Hi, yes, Chair. How are you?
Good, thanks. How are you tonight?
Good, thank you. I'm hoping folks will be able to support this bill. Just wanted to state that expressing the breast milk is nothing. It's not something that should require reasonable accommodation at the workplace. It's a natural function, and that we should be supporting this bill to provide safe and secure location for women to do this. The executive branch already has a policy in place which directs that the reasonable accommodation should be met. And because of that, we already have a bunch of these rooms available. But our bill goes a little bit further than that. This bill will require lactation rooms in all relevant county buildings, keyword there being relevant. And it includes those branches of government that are not under the executive's policy. Also, the state of New York requires this for all their buildings, and it's a good policy to have in place for our buildings as well. And I think it would make life easier for moms, and that we should be supportive of that.
I agree. We had one of our employees at National Grid in our control room. We just arranged a lactation room, and it was you never realize how much it's needed until you need it. So I'd like to go on for the committee if they have any questions.
Mr. Chairman, I've got a couple of questions real quick.
Sure, Frank, go ahead.
All right. First of all, I see the way we're financing this is that we are moving $75,000 from 2 lines. And so we have a total of $150,000 that's being used to finance this. Is that correct?
It should be 75 grand total.
75. Yeah.
75. All right. When I looked at the resolution, it looked like there was $75 being moved from 2 different lines.
Oh, it's just it's not. That's not the intent. It's just the way that budget amendments are made.
Okay.
It's 75 grand flat.
Okay. All right. And my question is, there's no fiscal impact statement. And first of all, I'm 100% on board with this. I support this 100%. I don't have any issues with it, but I'm just wondering about the financing. There's no impact, fiscal or financial impact statement, and we're spending $75,000. How did we arrive with that figure?
So I didn't put it in a fiscal impact statement because I believed it spoke for itself. I can generate one before the April meeting, but looking at, as Legislator Plotsky already spoke to, the executive branch has been implementing this. So for the executive branch departments, a lot of these already exist. 75 was an estimate that will make sure that any modifications are covered. We don't want to have no money for it or not sufficient money for it, but we also didn't want to put in $1 million because it's clearly not going to cost that much. So that's ultimately how the 75,000 was arrived at. It should be sufficient to make any modifications necessary to our current departments.
Do we know, as an example, I saw in the resolution that some of these rooms can be dual purpose, which is good because you may not always need this room. But has any thought given to how many rooms you'd have at 112 State Street? Will it be one at the Board of Elections, one at Clarksville? And any idea as to where these are going?
Both the resolution and the current policy we have in place, as well as the state law, control the parameters of these rooms. Number one, they can't be bathrooms. They need to be relatively close to running water. So, I mean, it could be near a bathroom, or it could be near an office kitchen. I mean, that's just sanitary. What your question as to the Board of Elections and Clarksville, yeah, it's every county building, that every relevant. So I know DPW has salt shacks where employees don't actually work. That wouldn't be a relevant one. But yes, there has been thought given to all the different departments. How many will actually exist in 112? Mike, I don't know if you know how many currently exist. I believe there's at least 2 currently.
Yeah,
Again, I'm in support of this. I mean, I don't have any, I think it's a great idea. It's just that if we're going to spend $75,000, I thought there may be a plan in place as to how we may be spending this money. That's all. Thank you. I'm good.
All right. Thank you, Mr. Moriello. Any other questions from?
Well, just to follow it up, if I could, Ray, to Pat, I guess, or to Vicky, it's not necessarily requiring us to spend the 75. It's just having the 75 there in case we need to make modifications. Oftentimes, I would understand it's often a room that exists already that you just amend into a lactation room, but it's just there if we need it. Is that correct?
Yeah, it's not requiring that at all.
Okay. Yeah. Thank you.
Thanks, Mr. Miller. Any other questions from the committee?
Okay, I have my hand up.
Oh, I'm sorry, I didn't see that. Go ahead.
Okay, I just, the only thing I wanted to say was that I think this is a great idea. And we're probably slow in getting it started, but I'm glad that Joanne moved this forward. And I just would like to say, please add me as a sponsor. Thank you very much.
Thank you, Ms. Willingham. Any other questions from the committee?
Chairman Joyce?
Go ahead, Mr. Grimm.
Yeah, thank you, Chairman Joyce. Yeah, I just want to follow up on what Vicky said. She said we're already doing it in the county. So what are we doing now? What needs to be done, I guess, is my question.
My understanding is we have some rooms, but not enough rooms. Does that sound about right, Pat?
Yeah, so the state and federal law requires that it be offered as a reasonable accommodation. But if we think about it, it's a little bit rough. I mean, it's a natural bodily function. So what the state of New York does for their buildings is have a policy that all buildings be equipped with it. So it's a lot easier for their employees to actually obtain the reasonable accommodation because the rooms are already set aside. So the executive branch policy applies to all the executive departments, but this will, of course, apply to all county buildings.
So the question really becomes what's reasonable as an accommodation. And I think that's where you get into how many rooms you might have, apparently.
I don't think there has to be like 5 rooms on every floor. I mean, this stuff can be hashed out and figured out pretty easily. I don't personally have the numbers of nursing mothers at hand, but I'm sure HR can determine along with DGS how to make these decisions.
Okay, thank you, Mr. Chairman.
Thank you, Mr. Graham. Any other questions from the committee?
Yeah, I just have a question, Mr. Chair. Do we have an approximation of how many buildings will need lactation rooms? Do we have an idea of that?
No, but I can get that for you.
Okay, thank you.
And Mr. Chairman, just two quick things. Mr. Collins, you're going to get us a fiscal impact statement, correct?
Yes.
Okay, and then do we have any, should we get some input from the county executive's office?
Are you asking of him right now?
If, I see Mr. McLaughlin is on, should we
But-
get some input?
I've had my hand raised.
I'm getting to you, Ally. Give me 1 minute. What are you looking for, Mr. Moriello?
Just as I know the county executive's office is going to implement this. Any comments or concerns from them?
Right now, basically what I'll do is I'll have a comparison done between what we have. I know that, I've spoken to Mr. Collins recently about this. So I know there was a bit of a hiccup in providing a copy of our policy. So that's been provided now. Apologies for that. Again, as been mentioned, thank you for pointing out. We've been doing this since 2019. So for us, it's good that it's going to be universal across all of the various elected departments and divisions. And so at that point, it'll basically, I have a preliminary a review from the Department of Law to see how the policy will need to change. It doesn't seem like there's too much of too many modifications that would need to be made to bring the existing policy into compliance. And it wouldn't constitute much of a change to what we're already doing in our departments. But obviously the final version can change between now and then. So we'd like to see that. And then any information related to the number, I can certainly talk to my DGS folks and figure out if $75,000 is an adequate amount. Typically for our departments, the cost hasn't so much been from a room perspective, but having a refrigerator available for folks to store things and things like that has been more of the cost, so that the room is ready for if and when it is needed. The conversation that was had about having a reasonable accommodation, you need to make it as easy and as streamlined for this to occur as possible. It shouldn't be one of those things that should be difficult to set up. So, but that's pretty much where we're at.
Thanks, Mr. McLaughlin. Any other questions from the committee? I'm going to move on to Ally McLean Lane, who's had her hand up.
Thank you, Mr. Chair, for recognizing me. I appreciate that very much. So when I had the twins, I went back to work, and it was at the town of Colony. But the wonderful thing about it was I was only about, 9 minutes, 8 minutes even from my home, might have even been less. And so I could go home and pump and then leave and come back. However, as we know, I don't think that we need, one on every floor. I mean, I think one a building is probably more than sufficient. Just in my, I want to say recent experience, but then I'm going to be lying because it was 10 years ago. But it's not, it doesn't need to be fancy. It doesn't need to be anything. You just need a chair that is reasonably comfortable, and because you're sort of sitting there, and a refrigerator, and you know what, it is really appreciated that they're recognizing that this is something you need to do. And, so thank you. That's all, just a comment.
Mr. Chairman, just real quick, one consideration that I know everyone's supportive, so I don't want to prolong the conversation any further, but just because of our calculations up to this point aren't a matter of like every other floor or something. There's other considerations because some folks don't have access to all the different floors, right? So they can't go up one floor. So just to keep in everybody's mind, it's not quite as, for better or worse, straightforward as that. So that does go into the calculations of our current policy. And so that will continue moving forward if anyone had that question. I just wanted to let everybody know that.
Thanks for the clarification. Okay, I don't see any other hand. Any questions from the committee before we move on? Hearing motion to move,
Motion to move.
and that was Mr. Miller.
Seconded.
Second
Yes.
by Ally McLean. All in favor?
Aye.
Any opposed? That's unanimous. Thank you. Thank you, Ms. Plotsky.
Thank you, Mr. Chair.
Number 6, authorizing an agreement with the New York State Office of Mental Health regarding the expansion of certified and credentialed peer capacity and amending the 2022 Department of Health budget.
Good evening, Mr. Chairman. That would be amending the mental health department budget. And this is an initiative from the New York State Office of Mental Health. Their workforce development initiatives this year. I've already brought one to you and the committee in previous months. This is a one-time stipend for the purposes of recruiting and retaining peers in the workforce. You're all probably familiar with the value of peers in the addiction world, peers who have been certified in recovery services. OMH has a similar process where people are certified as peer specialists. And we currently have 4 people who would come under that category. And again, as I said, this is a one-time stipend, it's 100% state funding. And we intend, if approved, to spread this out amongst those 4 individuals that currently work for us in hopes that that will help retain them moving forward.
Thanks, Dr. Giordano. Any questions from the committee? Hearing, can I get a motion to move?
Make a motion.
Second.
Motion, Mr. Beston, second by Mr. Ward. All in favor?
Aye.
Aye.
Any opposed? Unanimous. Number 7, authorizing an agreement with the Psychiatric Group of Albany regarding psychiatric services. Dr. Giordano?
Yes, sir. Thank you. So the Psychiatric Group of Albany has been our consulting psychiatry group for the better part of 29 years, I think. This is a request to enter into a 3-year renewal with them moving forward for the amount that you see there. Just as a point of context, they offer us about 210 hours a week across our clinic, jail, and ACT program, serving just about 1,000 patients. There are 5 psychiatrists, 3 psychiatric nurse practitioners, and I think importantly, we are now at about an 80% reimbursement rate on this through billing for services. So as I say, this is a renewal for a group that has been working with us for quite a few years.
Thank you. Any questions from the committee? Hearing none, can I get a motion to move?
I'll
Motion.
make the motion.
Motion by Ms. Willingham, second by Mr. Ward. All in favor?
Aye.
Aye.
Any opposed?
Mr. Chairman, thank you, and to the committee, thank you. Be well, be safe.
You too. Thank you, Dr. Giordano.
Thank you, Doctor.
Moving on to number 8, amending the new Health Department budget, COVID-19 response funding. I believe tonight we have Ms. Witherspoon with us.
Good afternoon. I'll be representing the Health Department this evening. This request is to amend the 2022 budget to add funding to the per diem line to cover the increased cost of COVID case investigations that occurred in January 2022, and then also to fund the ongoing community vaccination clinics that will continue throughout the year. And this is 100% funded by our COVID response grant.
Thank you. Any questions from the committee? Hearing none, can we get a motion to move?
Make
Make a motion.
I heard Mr. Beston make the motion. I think Mr. Ward made the second. All in favor?
Aye.
Aye.
Any opposed? That's unanimous. Okay, number 9, authorizing an agreement with the New York State Department of Health regarding the lead poisoning prevention program. Witherspoon?
This is renewed funding for lead poisoning primary prevention program. This is for a new grant 5-year contract, and we are requesting to contract with New York State Department of Health.
Thank you. Any questions from the committee? Hearing none, can I get a quick move?
Got one. Wanda
I
does
got,
one.
I'm sorry. I'm sorry, I didn't press raise the hand. I got my hand up.
Oh, I'm sorry. Go ahead, Wanda.
Thank you. Can you give me a little bit more information about what you'll do with this money as far as the lead program is concerned?
So it provides a collaboration with local healthcare providers for assessing children's risk of a lead exposure, blood lead testing, also education and guidance to prevent lead poisoning. It also helps facilitate evaluation, medical management, including risk reduction education, environmental interventions, which includes going into the home, and coordination of services for children less than 18 years with elevated blood lead levels.
Can you tell me how many children, we've tested?
I don't have that on hand, but it is in our annual report and I can get that over to you.
I'd appreciate that. Can you also tell me how we get the information out?
Oh, so we have our public health sanitarians that go out into the community. We also get referrals based on lead testing results that come from pediatricians' offices. So there's a couple of ways that our program gets out into the community.
You said a couple of ways. I really would like to a little bit more information on where this information is and how people see it. And also to be able to understand what they may have in their home, which may affect the kids so that they would know to look for it.
Okay, and also just to throw out there that we also, with this contract, we also advertise on our bus shelters. So that's one way that the community will find out about what we have to offer. And all of the other information I would make sure to get right over to you.
I would appreciate that because the more parents know how their children may be affected by lead poisoning in the home or other, I think that is the best way to really educate people as to what they're really looking for as far as lead poisoning and how they can keep their children from being, affected by that.
Yes.
And just please put me down as a sponsor for that, Ray.
Sure.
And I really would like that information.
I will definitely send it over to you.
Yeah.
Thank
Chairman,
you so much. Thank you.
Give me 1 second, Mr. Miller. So Pat, it looks like Rebecca meeting had one as a sponsor.
I would like to ask the same, Mr. Chair.
Got it.
Thank you.
I'm sorry, I didn't see you there, Brendan. Can you add Miss Willingham as sponsors?
Not a problem.
Thank you. Mr. Miller, do you have a question?
I just wanted to ask if that information could go to the whole committee, please, from the health department about the lead program.
So any information request, I blast out to all three, the chairman's office, majority leader, minority leader, get out to all members.
Okay, appreciate that. There's no other questions. I'll make a motion. Oh, sorry.
Go ahead,
I'm
Ms.
sorry. Yeah, I just would like to see samples of what is posted in the community.
Okay.
Thank you. And I make a motion.
Okay, so any other questions? Hearing none, Ms. Willingham made a motion. Second.
Okay.
Second by Mr. Miller. All in favor?
Aye.
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 Any opposed?
Aye.
It sounds unanimous. Thank you. Number 10, authorizing an agreement with the Cornell Cooperative Extension to provide training courses for lead-based paint remediation.
So this accompanies our previous request with some of the funding that we are getting for that lead program. We will be subcontracting with Cornell Cooperative Extension, and this is something that we have always done with this funding. And they provide renovation, repair, and painting training courses to the community in efforts to remediating any lead issues.
Thank you. Boone. Any questions from the committee?
I'd like the same information on that. Thank you very much.
Yes.
And if there are no other questions, I'll make a motion.
Thank you. Motion made by Ms. Willingham. Do we have a second?
Second.
Second by Ms. McLean Lane. All in favor?
Aye.
Aye.
Any opposed? Unanimous. Number 11, author.
Sorry, before you go to 11, just, I know we voted already, but I just looking through as I was just searching, the letter on that past one we just did talks about an amount of $225,000 on funding. But then the resolution only talks about 26,500. I don't know if that needs just to be addressed. It's two different amounts.
The resolution is a previous request. Usually we just add like
Oh, okay, that's it.
of a previous request. And that was, I think, just for, and this is for the total 5-year grant period.
Gotcha. I see this from October now. I sorry, didn't catch that. Thank you.
Thank you. Can I get New York State Department of Health and Cornell Cooperative Extension regarding the Public Health Corp program and amending the 2022 Health Department budget?
This is new funding from New York State for the Public Health Core Program. Albany County Department of Health is requesting to contract with the state for this funding and also subcontract with Cornell Cooperative Extension. Cornell will recruit, hire, train, and manage these fellows. The daily responsibilities include data collection, data analysis, community outreach. The public health issues that they will address is COVID-19 topics, chronic disease prevention, emergency preparedness, and other topics as needed. The county is awarded up to $3 million for the program, and we are requesting to subcontract with Cornell for the amount of $750,000. And this program ends July 31st, 2023.
Thank you. Any questions from the committee? Hearing none, can we get a motion to move?
Motion.
Motion made by Mr. Miller. Can we have a second?
Second.
Second by Mr. Ward. All in favor?
Aye.
Aye.
Any opposed? That's unanimous. Thank you for joining us tonight, Ms. Witherspoon, and thank you to the committee.
Thank you for all of your support. I will get all that information over to Mike, and then Mike will disseminate it to everyone. Thank you. Good night.
Thank you.
Thank you.
Can I get a motion to adjourn?
Motion.
Make a motion.
Second by Mr. Best, and all in favor?
Aye.
Aye.
Aye.